They're looking into things that we might have been taught about in medical school years and years ago, like mitochondrial dysfunction and failure, and realizing it is a component pretty much of every single disease, every single chronic disease, including cancer for that matter. So people are starting to become aware of it. They're looking at things and tests that perhaps they never even thought of before.
You're listening to the Lifestyle Medicine Podcast with Dr. Ivan Rusilko, brought to you by Access Lab, where we explore new perspectives at the forefront of personalized healthcare.
All right, welcome to the Lifestyle Medicine Podcast. My name's Dr. Ivan Rusilko, and this is brought to you by Access Medical Labs. If your doctor's not checking diagnostics, he's not a doctor. And have I got the godfather of diagnostics today for discussions about anything and everything. Dr. Mitch Ghen, he is a world-renowned specialist in diagnostics and integrative medicine. He works very closely with the A4M. He's in charge of one of their fellowship programs, as well as teaches everybody about IV and oral nutrition. He has 4 books out now. They range from everything from the handbook to compounding pharmaceuticals to the answers that every physician needs to longevity practices in their actual medical practice. So Dr. Ghen, absolute pleasure to have you here today.
Thank you. Is the fact, Ivan, that you call me the godfather mean that you're saying I'm old? I just want to know.
Well, all I know is it means that you are the boss man. How's that sound?
Oh, okay. All right. I'll take it that way.
Well, thank you so much for being here.
A pleasure.
And definitely, there's so much to chat with you about. I just want to, first, get to know how you're doing, my man.
I'm doing amazing. I'm doing great. After 44 years of doing integrative medicine and still doing it, it means there's something very much to this medicine, more so than the conventional allopathic or osteopathic model.
I couldn't agree with you more on that one. And in 44 years, what would you say the most impactful thing you have seen is currently right now in the integrative medicine industry?
Well, we're seeing, I think, an approach instead of doing an if-then approach, which allopathic medicine and osteopathic to a large degree too has been built upon. We're now looking at the words like root cause. We're asking a question, why? Why does someone have this instead of just putting a Band-Aid on the situation? That makes a massive difference because once you could determine where the issue is, then the treatment or the remedy comes right behind that. I think that's where the main thing that we're seeing in medicine today. And we're seeing a major shift amongst physicians, other healthcare practitioners that are tired, and so are the patients. They're tired of being sick and tired.
No, for sure. And again, we're seeing right now, I believe it's evaluated at a $6.7 trillion global industry right now, and it's only getting more and more speed as people start to catch on. And I couldn't agree with you more. I think allopathic and osteopathic medicine, you are kind of trained to put Band-Aids on hemorrhages. And then the whole the whole integrative aspect, wellness, regenerative, whatever you want to call this industry currently, I think it's all about sewing that hemorrhage shut. I always like to joke with my patients,
Yeah, that's true.
Yeah, no, very, very true. And I think one of the biggest things that I think we're seeing is a lot more people who are seeking therapies outside of the traditional norm, especially when it comes to things like neurodegeneration, autoimmune dysregulation, as well as cancer. Now, I know for Access, you are kind of the go-to guy. You're their physician consult for when doctors love to test, but when they don't understand what they actually do with those tests, they give you a call. So I'm just kind of curious: are you seeing a big uptick in people testing things like cancer or things that are indicative of neurodegeneration, and then they're calling to see what your actual treatments are?
Yes and no. I think the majority of the is getting used to understanding the both physiological and functional basis of disease, and that's pretty much where everything is. It's in biochemistry and the physiology. I think more and more doctors are heading that direction. There are some that are going beyond that. They're looking into things that we might have been taught about in medical school years and years ago, like mitochondrial dysfunction and failure, and realizing it is a component pretty much of every single disease, every single chronic disease, including cancer for that matter. So people are starting to become aware of it. They're looking at things and tests that perhaps they never even thought of before. And having the privilege to teach for NSU, Nova Southeastern for the past 5 years, the course in a metabolic approach to cancer, I'm seeing a lot more people joining that circle and saying, this is complex. And I'm going back to what I learned in my first week of school, but I realize now how important it is to do that.
No, for sure, for sure. I always sit there and say, I think that the basis of this industry should be in both cellular health, which is going to be, indicative of the mitochondrial's ability to produce ATP and function properly, as well as things like senescent cell clearance and things like that, because those kind of dictate everything upstream from it, which would be hormones, nutrition, heavy metal toxicities, things like that. When it comes to, this is a fascinating topic because I think it's my favorite, mitochondrial dysregulation dysfunction. What are the most important labs that you would suggest doctors test? I'm very curious because every doctor has a different opinion.
Well, again, there are several things that you can test to determine what's happening in the mitochondria. One of the tests you could do is cardiolipin. Cardiolipin belongs to the inner membrane surface of the mitochondria, and either its elevation not only means there's maybe a cardiolipin or cardiac artery disease disorder, but it's also telling you there's something wrong with the mitochondria. Other things that are a little more subtle, they're looking at LDH, lactic acid. These things are pretty predictive. If they're elevated, that the body is using the wrong kind of method of making most of the ATP, the energy that mitochondria make, which means that it most likely is dependent upon the Warburg effect or this glycolysis effect, taking one molecule of glucose and changing it into lactate. And that you can see through doing some of these subtle evaluations as well. Those are the biggest ways. There are, and there is, a few companies now in the mix that literally will take your biochemistry through like a blood spot, put it on a muscle cell, and we'll look at the mitochondrial advantages or disadvantages by running somewhere between 11 and 12 tests. So that's out there. We don't do that at Access as yet, but those are secondary tests that can be done to determine if the mitochondria is functioning appropriately, both at rest and when it is stressed as well. And it looks at many things like reactive oxygen species and what pathways it's using. Is it using glycolysis mainly, or is it going straight through oxidative phosphorylation and making enough of this ATP? Under normal circumstances, just to remind our audience, one molecule of glucose will become typically a net, under the best conditions, 36 molecules of ATP.
I love that. It's always fun because I also do a lot of lecturing for like the A forum and things like that as well. And it's always unique to see physicians who think, NAD, 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 yet they have no clue how the actual process of NAD, FADH2, all these different things that go through and actually create the actual molecule of ATP. So it's always unique to sit there and see how kind of that light bulb goes off in doctors' heads. Be like, oh, I remember, I just skimmed through this. You know what I mean? Like back in chemistry and in biology class. So it's always fun you actually bring that up. So one of the most important parts of diagnostic testing is what to do with the results. Obviously, that's why you do it. When you find somebody who comes in who is actually testing for things like mitochondrial dysfunction, what are your go-tos to help improve the actual mitochondria and basically how they work?
Well, I guess it really depends on where I see the errors occurring. So look, as a integral part of aging, you're going to have mitochondrial dysfunction. You want to add in cancer, you want to add heart disease, you want to add autoimmunity, and you're going to have more mitochondrial dysfunction than perhaps the 18-year-old. So that's really the comparison. You're asking, where do I go to help this type of thing? Under normal conditions, the very first and most obvious thing that you could do is get out into the sun, because most people are sun deprived.
Yeah.
And there's no question and that 40% of the sunshine happens to be near infrared. That's the early morning and right before sundown exposure that you can get. That near infrared does, convert the chromophores in through the skin, which then stimulates the mitochondria. I mean, we could get into all the other things, including using NAD and blocking these pathways that may be interrupting it, looking at too much reactive oxygen species. I think most don't recall or don't remember that 80% of the reactive oxygen species that our body makes are made by the mitochondria.
Mhm.
And it's a fine line. I've been too little of them, and there's no way for the body to defend itself against viruses and cancers and things of this nature. Too much of them can be tissue damaging, especially in patients, whether they have cancer or not. So your amount or things that you do have to be adjusted accordingly. If you're overzealous, for example, like all vitamins and nutrients are antioxidants, being overzealous with them could theoretically lead to, too low of reactive oxygen species being performed. It happens not very often, but it happens because most people have the other side of the coin, as you can imagine.
No, for sure, for sure. And when it comes to lifestyle adjustments, is that something you also like, suggest to the physicians who call and ask you, like sleep, exercise, sexual health, mental health, emotional health, things like that?
Pretty much lifestyle's always the first thing. When I teach the cancer course for NSU, my very first part, and it's coming up this August 23rd. So I put the plug in for it. Um,
There it
but
is.
But actually, the very first component of the course is 2 hours on lifestyle adjustment. And it's everything from what you put in your mouth. And again, the things you mentioned, exercise, sleep, your attitude, what you believe. The simplest thing is having a positive affirmation in your head when you wake up in the morning can make the difference between having good mitochondrial activity and not.
Mhm.
Eating the right foods or eating the wrong foods, or not eating enough stimulatory foods. Like, simple things like, coffee is good. Organic coffee is a good thing. 3 or 4 cups seems to be the sweet spot. And, putting 100% cacao in something of this is also helpful for it, for initiating the mitochondria. Using honey instead of other carbohydrate sources for, getting some carbohydrate and some interest to the mitochondria, getting out in that sun. And if you can't get out in the sun, are you utilizing some source of near infrared that it creates enough joule force to mimic the sun's infrared level, which we do. Like, for example, in my office, we use an near infrared bed that produces 78 centimeter squared kilowatts, which basically is about almost twice the sun with 38,800 LEDs. That makes a massive difference. That
For
does
sure.
create what we're looking for, which is photobiomodulation. All these things will affect. And of course, if their sugar's elevated, you bring it down. If they have autoimmunity, you need to, lessen the autoimmunity. And I don't mean by use of drugs that will drop the immune system. So far, I'm talking about immune modulation. I know we're a little bit all over the place with this, but I think that clinicians need to start thinking that every one of these disorders I mentioned earlier are and will, at least if not rooted in, become part of a metabolic dysfunction,
No, for sure.
which is mitochondrial dysfunction.
Yeah, and I see a lot of doctors. So at my clinic, I always doing mitochondria is the first thing I go after. I think cellular health is the most important. Then you get into, like I said, nutrition and everything else, which is a byproduct of it. But I also take a rather large look at things like senescent cell clearance, natural killer cells, apoptosis, and whatnot. Because I always sit there and say, if you're going to start building the system up, you want to make sure that the garbage is getting taken out as well. I think there's others like you said, there's a lot of oxygen-free radicals that are actually created through mitochondrial, how they work and everything. So did you ever suggest anything that's kind of like, okay, let's take A, B, and C to help clear all the garbage out of the system, high dose glutathiones, things like that?
Yeah, actually, I've developed a product that I use. Pretty much all the things that we use, I developed. I actually developed a product which I call anti-aging senolytic. There's about 35 physicians throughout the country use this similar. It's actually based on the work of one of the major institutions that did it in the mouse, which found that, of course, without using a senolytic, and xenomorphic, senolytic meaning some agent that removes the cells that get old that don't know to die, and so to leave room.
Yep.
And for those listening, xenomorphic means that these cells that stay around, they give off inflammatory type of
Zest.
substances. So you need something to remove both. And so in that category, I've developed the first product. I think it's pretty much the only one that's very high doses of fisetin, luteolin, apiginin. It has high doses of quercetin, all
Yep.
of four things without curcumin because I use curcumin elsewhere. But those five substances have been clearly identified as the ones that help to remove the senolytic and the xenomorphic cells, regardless who we are. I mean, once we get past 40 years of age, we're making those cells every week. You can't
Mhm.
get rid of all those cells. That's impossible because you're making so many a day. But if you take it down to a minimum, you'll have less of an inflammatory type problem. And you will find them more chronically ill the more that occurs. So you're right on the money, Ivan, when you're talking about you should be identifying that because, for example, in cancer, it's extremely heavily made in patients with cancer. They're making a tremendous amount of these cells, and you're also correct. At Access, we do this white blood cell phenotyping, which can help you identify what's going on because it looks at the natural killer cells,
Yep.
the CD4, CD8. You can typify, hopefully, through that patients that are in a CD4 helper cell versus a suppressor cell state or Th2 state.
Mhm.
And cancer typically, for example, since we mentioned a few times, is fought in a Th1 state. And there are great substances that you and I and others in the functional medicine field can use to sort of push the Th1 state, for example, versus the other. And then there's others that are balancing of the two. So yes, you should be using senolytics and these anti-aging senolytic and xenomorphic substances pretty much in anyone over 40 years old.
Yeah, no, it's funny because I was thinking I'm glad that you work for the A4M. I've been with them since I think 2010. I think my first speech for them was the 7 different ways to make a woman smile, the different orgasms women can have medically. You know what I mean? And it's funny to sit there and see how that industry has kind of morphed. And I always like to say I always try to be about 3 years ahead of the curve, which you're probably 12. But I'm thinking in the next 2 years you're going to see senolytics become the new NAD because nobody's really even talking about it when you go there. And that's kind of the hub for what's new and kind of what's upcoming. So I'm very curious to see. I always slip it in whenever I lecture for Access. It's always talking about natural killer cells. And I see every healthcare practitioner start scratching their head, being like, "What the hell's a natural killer cell?" You know, what I mean, like that's one of the most important things that we should be treating, right?
Yeah, that's kind of interesting. I mean, there has even been studies done with like dasatinib
I actually
um,
use
and,
that.
and corset.
I use that with high dose quercetin, and then there's also
Yeah,
FOXO4 DRI, which is the injectable version peptide, which is spectacular. We've had phenomenal results. We see a lot with chronic back pain. Because any type of inflammatory place, those cells are terraforming, it's becoming more acidic. So it's always that aspect of the fisetin, I think, is phenomenal, quercetin, all of that kind of stuff. And I always combine it. I never do a senolytic program unless there's a mitochondrial stimulant there to kind of get to kind of
yeah.
clear the actual garbage.
Good, very good. You'd be interested in, I'll try to introduce you to it, this natural product for those that you don't want to have on a cancer medication,
No,
even
no, for
though it's
sure.
low dose. Yeah, yeah, it would be
No,
interesting.
that's great though. And so I mean, when it comes to that, I'm curious because cancer is kind of the buzzword these days with everything going on, with all the different stress going on. People are getting cancers they never thought they'd get, and there's a million different conspiracy theories we could go over. But I'm kind of curious when it comes to the actual senescent cells. What percentage do you think of people who actually get cancers have a high toxic load of senescent cells, zombie cells, whatever you'd like to call them? I'm guessing it's pretty high,
All,
right?
all of them.
Yeah,
I
all of
believe
them.
I believe it's all of them, Ivan. I mean, when the body has all this inflammation, which most cancers are propagated from inflammation, not all, but it is one of the 14 criterion or
Oh, yeah.
hallmarks of cancer by Weinberg and Hanahan. There is a tremendous amount of this, and you're seeing it, by the way. Name the disease, you're going to have a lot of it. But I believe, and I treat every single one of the cancer patients with a senolytic xenomorphic agent without fail.
Fantastic. I absolutely love that. I see a lot too. So I in the last 3 years, I've gotten really heavily into the polyphenol IVs. Do you use those at all?
Which one?
The polyphenol, so the curcumin IV, quercetin, resveratrol, and ECGC or green tea.
Yeah, I do. Well, I can tell you from those, I don't use them intravenously. Not at this point. I used to a long time ago. There was unfortunately this one death with curcumin a while ago. And my problem is the polyphenols, I don't think will stay high enough
I
intravenously
see.
long enough. It'll be too short-lived. But I use heavily the polyphenols. And to tell you the truth, with green tea, I actually use it intravenously. That I
Okay.
do. I make my own green tea, but there is a whole theory, and I work with the person who actually did the work on it. The Moores, who are both gone, the husband and wife, they were researchers in I'll think of the state in a minute. They had passed away, but they would left their legacy basically to the person that worked with them. Her name is Hanau, and she did work on it and continue the work and continue the lab, etc. And she uses green tea as a ongoing, continuous infusion for cancer because of the fact it blocks a receptor that is only on cancer, which is called an enox-2 receptor.
Yeah.
We all have enox-1, we have enox-3 receptors when there's autoimmunity, but enox-2 only is available to a cancer cell, which allows for unregulated cell growth, and the combination of that and a red pepper or guayule pepper combination that they came up with blocks the two heads, which goes approximately every 24 minutes, turns on and off. So if you maintain this level within a proper within the optimal level, not too high, not too low, and you use something that blocks the resistance, it typically will allow pretty much most cancers to die, even if the deep ones and their metastatic patients do extremely well with this kind of approach, by the way.
No,
Extremely well.
great. No, very, very true. And again, it's kind of funny. I started out with, here in South Beach, it's all about, bikinis, fun, sun, sexual health, and things like that. And I've kind of transitioned to, at least over here, the doctor of last hope. So we get people flying in for cancers all over the place because we've actually done very well with it. And, one of the IVs that we use, there's actually two of them. One is the high dose of vitamin C and the other one is the methylene blue. So I'm curious to see your thoughts on if those are effective in your opinion, or if you actually use those at all.
I do. So first, I think I should just tell you, I mean, I wrote the textbook on intravenous nutrition, the only
I,
textbook in the world
I saw
i-
that.
is is mine. Yes, and I use high dose vitamin C. It has to be.
Sorry, go ahead. At which doses do you go? You start at 60 and move up, or?
No, I typically, well, it depends. To get to a tumoricidal dose, you have to be at 1.5 milligrams per kilo.
Yep.
That is a tumoricidal dose, assuming that the patient can take it, because there are several issues with
Yep.
high dose vitamin C.
Big
Some
issues.
people just can't get there. Below that or too low, it's antioxidative. You don't want an antioxidant, you want an oxidant. When it's high enough, it does the trick that it's supposed to do. It creates enough of hydrogen peroxide to kill the cancer cells. It creates an environment as well where it dissolves or stops glutathione, which chokes the cancer cells as well. And I do use it heavily. I don't use methylene blue intravenously typically, but I will give it later on in the treatment to help the mitochondria
Yep.
to reestablish themselves. But again, both vitamin C and methylene blue need to be, of course, and I would say this for those viewing this, in those folks that have a normal G6PD,
Big
the
time. Yeah.
G6 phosphodehydrogenase, because if they have that deficiency, either one of them can have a hemorrhagic event if they take too much in either of those things.
No, very, very true. Also, SSRIs for the methylene blue. That's a big thing we found as well.
Oh, yeah.
But I do find it quite fascinating that, everything in this industry is all of a sudden becoming so much more mainstream now. Everybody's got Mel Gibson talking about it. You got all these influencers talking about it now. So it's always kind of unique to see something you've been doing for 44 years. I've been doing it for 15. I thought I was old in the industry. And then, all of a sudden, it's starting to see it become mainstream and actually almost the gold standard for medicine, the way everything's starting to shift, which I think is personally exciting.
Yeah, I look at, I'll tell you what, I'm older than you, so I can tell you a story that, years ago, if someone would say, Mitch Gen's using this bacteria to have people swallow this bacteria. Oh my gosh. And of course, now the GI
Oh,
Society last year, everyone takes probiotics, everyone knows about it. And it was all like, oh my gosh, this high dose vitamin C and vitamin C, that's crazy. It doesn't make any sense. The same doctors that would do it. I have a little over 500 physicians that will see me when they're sick. So it's like, and a lot of them were the ones who were going, no, that's ridiculous, it's crazy. Now let me learn, let me teach you. And I'm a consultant for a lot of people. It's a nice thing, actually. I went from being totally crazy, I guess, to the dinosaur of this. You know, I guess either one is okay. The
heck
point,
yeah.
the bottom line, as you and I know, Ivan, is the outcome for your patient.
Yeah, the efficacy for sure. I mean, there's
And-
always good
oh,
aspects when it comes to like the doctors, when it comes to profitability and business. And yes, it is a very profitable business. It helps, but the most important part is the actual efficacy. We're actually treating the problem, not just putting a band-aid on it, which I think is great.
and-
And
yeah,
to speak to your point, I remember when I came out in South Beach, I graduated very early, so I was 27, a full-fledged physician down here, and there was nothing on the beach. There wasn't IVs, there wasn't anything. So to come out, and I was in every magazine being like, "Is this snake oil? Who's this kid?" And now all of a sudden, you
yeah,
can't throw a stone on Mount Miami Beach without seeing some type of rejuvenation clinic or IV
I
clinic.
know.
You know what I mean? So it's good, but it's also kind of scary. I'm curious to see your thoughts on now that I saw that ever since COVID. I'm curious to see if it's the same for you. First off, my business went through the roof because now people found out health isn't free. You know what I mean? Like health, you have
Of
to invest
course.
in yourself for. But number two is people started to have a distrust of traditional medicine. So now they started to come into this industry. So, like you said, you see a lot of people who are naysayers and no, 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 this isn't great. All of a sudden, they sit there and see, all right, well, maybe we have to pivot because we aren't making money now like we used to as a traditional physician. So they pivot into this industry without really any training. They're just giving testosterone blindly and growth hormones and IVs. They're getting things off the internet for. Are you seeing a lot of that go on now? With the people you deal with, because down in Miami Beach, it's almost an epidemic of just how terrifying it is the amount of people I have to correct that come to see me versus people I start.
Yeah. Do you have 2 hours? The So I'll do my Reader's Digest version of this. The truth is, unfortunately, a lot of people go into this without much training, and they develop these things which I'm horribly against, which are, and I apologize to the people watching, but I really don't, and because I've trained most of them, and I've trained most of the people that are down there in your area as well. When you have an IV bar and you go in and pick out what you think you need without the proper understanding of the person's biochemistry, you run into two problems or three. One, you're going to do nothing for that individual. Two, you may cause a problem with that individual if you don't know their biochemistry. And three, you may be just wasting their money and, making something worse, whatever entity they came in worse for. They won't know because if you haven't examined the biochemistry and followed it,
Exactly.
you'll have no idea. I tell people like that, it's unfortunately there's a thing in someone's head, it's only vitamin C. Okay, we'll use that as an example. How is that going to be any problem? It's just vitamin C. So you put it in and that's it without any thought of that there are some serious consequences associated with using the wrong dose or how you use it or the speed or whatever it goes along with it. But I tell people, look, would you go into a whatever office, name the specialist, oncologist, and pick out two or three cytotoxic cancer medicines, or wait,
Yeah.
or go to the neurologist and pick out a couple meds, or go into a pharmacy even and say, hey, listen, just give me these medicines. The reason you don't is because there's oversight and there's, a reason why people go to medical school and do subspecialties so that they're prescribing as best as can these type of thing. There should be no difference when it comes with anything that you prescribe, whether it's a nutrient, especially if you're putting it intravenously. The consequences are much less than a medication. but there are consequences. And I know because when there are, I get, the call from a plaintiff lawyer saying, Mitch, can you look at this case? And,
Yeah.
I'm the guy, I want to help the practitioner. And I'm also the guy that knows them typically. And I'll call them and say, you're stupid, but let's see how we can fix this thing.
Touche. No, it's true. And again, so at my clinic, it's always blood work, blood work, blood work. And that's why I love working with Access. We together have kind of developed the most in-depth blood tests in the world, I think, right now, which is awesome. But again, like I always sit there and say, like, there's blind IVs and then there's actual tailored IVs. And I think patients, once they actually understand what with the value of diagnostics, which I think is starting to catch on right now, you're seeing things like functional health and all these like Instagram things being like, test your blood, even though there's nobody to read them, except AI, which that's a whole nother conversation. But it's just funny to sit there and see like now people are actually taking diagnostics more seriously. And I think that's the root of precision medicine. I call this lifestyle medicine because, your lifestyle, I think, is the four most important things: sleep, stress, hydration, and nutrition. Those are the four things that are the basis of everything. And then everything works up from there. And I think nothing can go anywhere without diagnostic testing.
Yeah, I don't think you can I told you early in the thing, if you don't understand the individual's biochemistry, how in the world would you know how to supply them? We're 32 trillion cells at the least amount.
Mhm.
And if you figure out the amount of chemical reactions there are per second, they're
Mind-blowing.
in the trillions per second, you would not be able to know. So without having that, I call it the 150 car check. You're too young. The cars, when I was younger, you took your car and they looked under the hood. They examined the air filter and the oil filter, and they said goodbye, and they oil and lube your car. Now they hook you up to 150 check to try to get some handle on it. If you haven't done that, you will not have a good idea of what the patient's problem is, along with some physiologic testing. That's what, guarantee. Well, it doesn't guarantee you, but it allows you to get a much better handle on the individual and prescribe, like you said, a personalized individual type of medicine for them.
No, for sure. Now, with you, I know you teach on it, which I want to get into as well. For your clinic, do you actually design the actual nutraceuticals specifically for them as well, like you do with the IVs?
Oh, I do. I've designed about 30, 35 of them. Each one took about 2 to 3 years. I took my clinical experience. My wife's a nurse practitioner, and her and I used for each one probably somewhere between 300 and 400 research articles, so that what we put together made sense. Because they can go to everyone from the internet and everything else, and I have to just tell you a story. Can I divert for one
Of
second?
course you can.
Because it hit me what you said before, which is so true. Thank you for that. You're a gracious host. I had I once now there's so many people that have given themselves name. They're lifestyle specialists. They're this specialist. They're they're bio this. They're
The guru.
biohacker. Yeah, they have all the degrees that they've made up
Mhm.
basically, and things like that. And recently I did a lecture. I had a lecture I was giving to a group of people, about 400 people. And I said to them, I want you to all know, I've got good news for you. Is anyone traveling this summer? And people raised their hand. I said, listen, if you're gone by plane, you have nothing to worry about, because I've been watching a lot of YouTube stuff. I've read about 10 reference books, and I am now an airplane biohacker. So I I'm going to check your airplane for you and make
Uh-huh.
sure it's safe for you to fly. And they're all laughing. And I said, as funny as that is, are you aware that an airplane is 1 million parts? That's a true statement. It's give or take. It's a million parts. You know how many millions of parts and trillions there are in the
I was
human
gonna say,
body?
yeah.
So you have to think about this. In any case, to go back to the conversation after I diverted, yes, I developed my own nutrients pretty much because I want them to be at a certain standard. That's number one. Two, I want to specifically get done what I'm trying to get done. Like, for example, in the anti-aging senolytic that we discussed, we developed that based on the Mayo's work in this area on mice, which they found increased their lifespan 15%. Well, that's a lot if you start taking these things, and it's obvious that you're steeped in it, and smartly so. So we developed things in that area, from heart to sugar to things that we use for cancer, etc. And the reason we did this is because we wanted something that was a professional product that spoke to this, as opposed to something that was off the internet, or something that sat in a warehouse, or, for example, something that, was multi-level marketed, which, just goes to the middle, thing. And, you and I are laughing because we know what that's like, but
Mhm.
the lay public, which has now become sort of woken, so to speak, to the
Right.
fact that the body's is not working good with the if-then medicine that we were all taught in medical school and residencies, that method of using a Band-Aid isn't working, and that they have to often get in charge of their own life. The problem is the way they're doing it may be to some degree helpful, to some degree not. They're maybe to the wrong practitioner, maybe to the wrong clinic, using, Chat GPT 4.0 and all this kind of stuff. So
No,
it
no, it's very true, very true. And
it's
I think
hard.
you actually touched on something very important there too. I think a lot of people right now are just be getting sucked in. And again, NAD is the hottest thing. If I hear one more or get one more ad for NAD, I'm going to shoot myself. You know what I mean? Like, I've been doing NAD since 2012. You since who knows when. But the thing is, I always say, like, any type of procedure needs to be multifactorial. Not just linear NAD, ATP. That's great, but then you have to think about the electron transport chain, the oxygen, everything. So every program I do will have 3 or 4 different peptides or different stuff, like nutraceuticals. Like, I use 5-amino-1-MQ, methylene blue, nicotinamide riboside, as well as the NAD, and actually riboflavin, which is a precursor to FADH. For all of my mitochondrial boosting programs, obviously I check and make sure everything is, there's no contradictions or whatnot. And I think that's the way I think medicine kind of needs to go. Is it's a multifactorial approach. NAD is great, but if you have dysfunction in any other part of it, you can't get enough oxygen to the thing, you're kind of pissing in the wind.
Yeah, and I agree with you. I call it the 360-degree approach, both to diagnostics and treatment. It's basically saying the same thing. And in about 2 months, I'll have a good surprise for you. I am the chief medical officer for a company that brings in pretty much the best NAD in the world. It is 30% more effective than the ones that we get in the United States. It is also has only two outside components in, as opposed that the ones that we use in America have about 9 to 11 contaminants. So I also built a product which has 13 things, and I heard you mentioned NR and B2 for the helping.
Mhm.
You'll really enjoy. We'll share this with the product with you. It's coming out soon. I did it for this company, but for sure it's nothing like anything that's been built yet. I think it's going to be great.
Oh, I love
Mm,
that. I love that. Yes,
uh,
we're definitely gonna have to share some recipes here. I have a couple of things I think you might find interesting too. But that's great. And again,
Super.
like, it's always good to talk to somebody who actually knows the science. You know what I mean? Like, you'll talk to all these doctors who have a million followers or this, that, and the other. Celebrities go and see them, and then you talk about, like, yeah, NAD's good. Well, what does it do? It's NAD. "Oh, what do you mean, what does it do?" I'm like, oh my dear God. You know what I mean? It's mind blowing. You know what I
Exactly.
mean? But knowing where something comes from and where it goes, I think, is the trick between a physician who gets into this for the wrong reasons and a physician who gets in this to actually help patients, because they understand the beginning and the end, not just the actual journey.
You know what I tell Ivan when I lecture to doctors and nurse practitioners and PAs? I always tell them, and pharmacists, because I lecture to probably 1,500 postdoc pharmacists every year as well. I said, if you really want to learn this medicine in any way, shape, or form, root cause medicine, don't do anything. Because they'll ask me what book to read. I said, read 2 books. Read a biochemistry book,
Mhm.
the biochemistry book, whatever's new and out there, and read. For me, it's Guyton's Physiology. I don't know what you studied, but ours was the thick Guyton Physiology book, whatever physiology text that they're using now, and go read it on the toilet, and go read it all. And once you know that well, then come back and start studying this stuff, because then you can think out of the box. If you understand how the body works, then you'll understand if you get a blood test and you do a very good comprehensive blood test, which sounds like you do, and folks that are steeped in this always do, then you'll understand not only that simple blood test, but the relationship to other tests and what needs to be done to help fix it. If you don't understand the physiology or what happens, or you don't understand the biochemistry of these tests, then it becomes more difficult. And you'd be surprised. There are a lot of people who do not understand why or how they do it. And they get a good result. God bless them, because they just were told, hey, do this and this. But I heartily believe if you want to stay in the space of being a root cause physician, like you named the other things, I like that name now. And Epic Times, when they interviewed me, I like that word, root cause now. It's not, I didn't
I
coin the
love it.
word. Somebody else did. It's not mine. But
We're going to say
still,
you did, though, just for the hell of it. How's that sound?
yeah. But it's a great way of describing what you're trying to do, is to get to the bottom of why. I mean, it's easy. The general internist, the cardiologist, the family docs, when a patient goes in, I mean, they're doing the best they can do with the knowledge base that they have. But often it stops at, I don't know, you're getting older. Now, that's fair 30 years ago.
Yeah, not now.
It isn't fair now. It wasn't fair to me when I started doing medicine either. That's why I've been in this space so long. It didn't make sense that we don't have a reason why. It's easy to say, here's a problem that we believe is a problem. Not all the time it's right. And go ahead and just use a medicine to press it down, or to correct it so you look good on paper. No good. You have to find out really what's underlying this. And again, to be really good in this space, I tell everyone, become an expert in physiology, become an expert in
Basic.
biochemistry, and then we can talk. But everyone does that the first week of their school or the first semester, and then it's
Then they
like,
flush it.
yeah, I don't want to know that anymore.
No, it's funny. I just came up. I gave a talk for Access and at the Relive event last week, and one of the things I like to actually exemplify this point was how methylene blue actually works, which I don't think anybody really understands it who doesn't know the root cause of it, how it goes through the redox reaction, ferric to ferrous, all that kind of aspects. It's just funny to sit there and see, like, physicians, I was going to say, if you know something, you should be able to actually describe it as a toddler. Again, I didn't
Sure.
say that either, but it's very true. And it's funny, I'll sit there and whenever I do a speech, which I'm guessing you have to play the room, correct? So when you sit there and you see a bunch of business owners or people who are just like, well, let's figure this out. When you speak to them like that, this is why methylene blue works. Not because it makes your urine blue, not because so-and-so told you to. Understand the basics of it. Then you can sit there and tackle iron issues. You can tackle cancer. You can tackle mitochondrial dysfunction, because you can actually understand how methylene blue increases oxygen in the system, which I think is fascinating.
Of course. And that should be their thing with even the simplest thing as handing someone a pill for ascorbic acid, vitamin C.
No, very, very true.
You should understand what you're doing and why. I tell people, and I tell patients, I'm giving you this. In 6 months, you can ask me again, why did I do this? I'm going to give you the same answer, even though I'm not going to remember I spoke to you, but I will tell you exactly why. I hand myself back your history, your physical, and your your biology, basically your blood test. I'll tell you exactly why I did it again. And if you're consistent with that and you understand it, then what you prescribe is going to help someone, because you have the capability of thinking outside the box. The only people good anyone could be good. I always say when I teach, you could be good at many things. There's a huge difference between being good and being great. And I will tell you the story. Do we have time to tell
We
the
do.
story?
We do. I would love to hear it.
When I was in my third or fourth year, I can't remember, I was in Philadelphia. I went to Temple University on a rotation for ears, nose, and throat. The guy at that time, I don't think Max is living anymore, but his name was Max Ronis. He was the #1 ear surgeon in the world. And on the very first day I went, they had grand rounds in the morning with him and his team. And after grand rounds, I knew the answers to pretty much every question they asked. I was only a third year or fourth year medical student, and the residents were like, oh my gosh. So when everyone said, okay, how you go with the residents where you go, they said, Mitchell, you stay with us. And very first thing was they said was, you can have a residency in this if you want. We'll actually guarantee it to you now. I said, well, that's very flattering. But the whole thing was about the second day in, they called Max Ronas, and this guy was the guy, to the operating room because they were having an issue. So he went to the operating room. Back then, there was a head and neck surgeon that still used ether. The thing stunk of ether,
Jeez.
ether. Can you imagine? A little spark and you kill the anesthesiologist, the patient, and everything. But
I gotta
back then they
say.
were so we go into this operating room. There are two attendings, three residents, and the anesthesiologist, and of course the circulating nurses and all. They said, Max, we can't get the tympanic membrane, the ear membrane, sewed back down. We can't get it to get back down. So this is what happened. And literally in silence, Max says, let me see, let me take a look. Now, mind you, he looks into the microscope. It didn't take him 20 seconds. He looked up at the anesthesiologist, says, you're using nitric oxide? And he said, yes. He said, turn it off. And because it's causing the bubble underneath that eardrum, that's why they couldn't. And he literally just walks out. By the way, it terminated them completely be able to do the procedure. So what made him great, and this is what I use the example between good and a great doctor, is the nuances. The point is anyone can take care of a cold, but can you take care of someone who has pneumonia and has a lung tumor at the same time? There's the difference. If you want to be in the category, to go back to what you were talking about earlier, Ivan, of the person that takes care of the cold, it's fine. We need people that can do that. We need that. But if you want to be the person to be able to take care of a complex disorder and you want to be steeped in this, learn your biochemistry, learn your physiology, and then let's talk.
I love it. Well, I would say, so I ask everybody in closing. So this has been fabulous. I'm not going to lie, but I always like to ask two questions. First one is for any physicians who are looking to get into this industry, who are coming from allopathic or osteopathic, or any healthcare practitioners in general, what would be the number one piece of advice you could actually give them?
Okay, well, I already gave it, and I don't mind saying it again for the third time. Pull out your basic sciences courses and relearn them.
Okay.
You're never going to get into this. Once you do, then you chunk it down and begin somewhere. Start with what you said. Start with the lifestyle choices. Start understanding diet, because I'll tell you what, when you start looking at diets, for example, in cancer, there is no one diet. I looked at over 1,000 different articles with an RD at one time, registered dietitian. We could not find that similar thing. You could talk about Seyfried's work and, doing a Paleolithic or a what do you call it, diet, and, a high protein carnivore, all these diets. The point is, for some, yes, and for others, no. And to get into the biochemistry is a story for another time. So that's where I would start. Start with understanding sleep. Start with understanding the sleep-wake cycle, the biochemistry of all of it. Start with understanding the physiology of exercise, because there is a physiology to exercise. Too much, and you don't normally do it, and you start, you're going to create other substances that no one ever talks about. You'll create nagalase, which will block the macrophage. You'll get sick, and you'll get there's a way of looking at it and accelerating it. So start with lifestyle things, what to eat, how to eat, and then start moving into nutrition, and then your hormones, and then your and one point I would also say in that question is, do not forget about the mind-body connection. I have a doctorate in psychoneuroimmunology, and the truth is, no matter how good you are with nutrition, how good you are with cancer, how good you are with NAD for those folks that think it's an all in all, if that patient feels that they are not doing well, they're not going to do well. What you think is what you create. What's your second question?
Second question would be for any patient who's watching this, what's one thing that you should be very cognizant about when you're selecting an integrative physician, a wellness doctor, whatever you want to call that? What's one thing a patient should be very cognizant about?
Their education. What have they done? Most patients pick doctors from the A's, affable, available, which they should be,
Sure.
It's hard to know what grades they got in school because we don't post them on our walls. But you should actually look into the most important thing is what is that person's true interest? Is it real chronic disease? Is it the lighter thing? What did they do? What have they written? Where do they teach? These are the things that will help you pretty much discern the ones that really stand above the crowd and the ones that are just in the crowd. And take your time, call them, see if they'll call you back and answer questions just about general, questions about what you have, and compare what they say to what others have said to you. And then use your heart and your guts, and you'll know which way to go.
I must say, perfectly stated from the godfather of diagnostics. I love it. Well, thank you
Thank you.
so much, Dr. Ghen. It's been an absolute pleasure having you on. I'm sure we could talk for about 3 days on
Sure.
on everything integrative here. But again, I want to a personal thank you. Again, we both work for Access in different ways, and it's awesome to have you on the team. And again, this conversation couldn't have gone better, I think. So thank you again.
God bless everyone. Thank you for having me.
Thanks for joining us today on the Lifestyle Medicine Podcast. At Access Labs, every innovation we pursue is driven by one bold purpose: making personalized medicine more practical and accessible for patients and providers. If this episode sparked new ideas or challenged how you think about patient care, awesome. Follow the show and share it with a colleague who's ready to level up their practice. Head over to our website at accesslabs.com and register your practitioner account today. You'll get access to over 1,000 routine and advanced biomarkers with 24-hour results. When signing up, select Lifestyle Medicine Podcast as how you heard about us and score 10% off your first invoice. Oh, and don't forget, drop us a review. It helps more practitioners like you find us. We'll see you next time.